First aid is a crucial skill that everyone should possess. It can mean the difference between life and death.
The ability to quickly respond to emergencies can save lives. Understanding first aid helps reduce the severity of injuries.
First aid isn't just for medical professionals, it is a skill set that can benefit everyone.
From parents to teachers to co-workers, knowing how to act in an emergency is vital. First aid knowledge empowers individuals to take immediate action.
Imagine a scenario where someone collapses from a heart attack. A bystander with first aid training can perform CPR. This immediate response can keep the person alive until professional help arrives.
The importance of first aid in such situations cannot be overstated. First aid also promotes a safer community.
When more people are trained, the overall safety of the community improves. This ripple effect shows the broad impact of first aid knowledge. It is not just about individual preparedness, but communal well-being. Emergencies can happen at any time and to anyone. Understanding emergency response is crucial. It ensures that you can act quickly and effectively. This knowledge can prevent situations from worsening. Knowing how to respond in an emergency builds confidence. It allows individuals to remain calm and focused. Panic can lead to mistakes. With training, you can avoid these errors and provide proper care. Emergency response skills are not just for adults. Children can also benefit from basic training. Teaching kids how to call 911 or apply a bandage can be life-saving. Early education instills a sense of responsibility and preparedness. Workplaces also benefit from employees knowing emergency response. Accidents can occur in any setting. Having trained individuals on hand can reduce workplace injuries. It also fosters a culture of safety and awareness. Emergency response principles are the foundation of first aid. The first step is assessing the situation. Ensure the area is safe for you and the victim. This prevents further harm. Next, check the victim's responsiveness. Speak to them and see if they respond. If there is no response, call emergency services immediately. Time is critical in emergencies. Once help is on the way, begin basic life support if necessary. This includes CPR for cardiac arrest. Keep the airway clear and ensure the victim is breathing. Circulation should also be monitored. Do not move the victim unless absolutely necessary. Moving them can cause further injury. Keep them calm and comfortable until help arrives. These basic principles are vital for effective emergency response. The ABCs of first aid are essential for saving lives. Airway, breathing, and circulation are the priorities. Ensuring these can stabilize a victim until professional help arrives. First, check the airway. Make sure it is clear of obstructions. Use a finger sweep if necessary. Tilt the head back slightly to open the airway. This is crucial for those who are unconscious. Next, assess breathing. Look, listen, and feel for breaths. If the victim is not breathing, start rescue breaths. Pinch the nose, cover their mouth with yours, and give 2 breaths. This provides necessary oxygen to their body. Finally, check circulation. Look for signs of blood flow, such as a pulse. If there is no pulse, begin chest compressions. Before starting compressions, call emergency services immediately. Place the heel of your hand on the center of the chest, right between the nipples. Interlock your fingers and keep your arms straight. Press down hard and fast, at least 2 inches deep at a rate of 100 to 120 compressions per minute. Perform 30 compressions followed by 2 rescue breaths. This helps maintain blood flow to vital organs. Mastering the ABCs and CPR can save lives in critical situations. Each step is vital in ensuring the victim's survival until professional help arrives. First aid for common injuries, cuts and burns. Cuts and burns are common injuries that require first aid. Knowing how to treat them can prevent complications. Proper care can also reduce pain and promote healing. For cuts, start by cleaning the wound. Use clean water to wash away dirt and debris. Apply pressure to stop any bleeding. Once bleeding stops, cover the wound with a sterile bandage. Burns require different care. First, cool the burn under running water for at least 10 minutes. Do not use ice as it can damage the skin. Cover the burn with a clean, non-stick dressing. Avoid applying creams or ointments to severe burns. Seek medical help if the burn is large or deep. Proper first aid can minimize the damage and expedite recovery. Rescue breaths are crucial in situations where the person is not breathing. Tilt the head back, pinch the nose, and give 2 breaths, watching for the chest to rise. The ABCDE approach stands for airway, breathing, circulation, disability, and exposure. This method helps prioritize life-saving interventions. Ensure the airway is clear to allow for proper breathing. Check for breathing by looking, listening, and feeling. Assess circulation by checking for a pulse. Evaluate disability by checking the person's responsiveness. Finally, expose and examine the person for any hidden injuries. CPR, or cardiopulmonary resuscitation, is vital when the heart is stopped. Perform 30 chest compressions followed by 2 rescue breaths. Use an AED if available, following the device's instructions. These skills can save lives and are essential for everyone to know. First aid for serious conditions, heart attacks and strokes. Heart attacks and strokes are life-threatening conditions. Immediate first aid can save lives. Recognizing the symptoms is the first step. For heart attacks, look for chest pain, shortness of breath, and sweating. Call emergency services right away. Help the victim sit down and stay calm. If they have medication, assist them in taking it. Strokes have different signs like sudden weakness, confusion, and difficulty speaking. Time is critical in stroke cases. Call emergency services immediately. Keep the victim comfortable and monitor their condition. Performing CPR may be necessary if the victim is unresponsive. Use chest compressions to maintain blood flow. These actions can keep the victim alive until help arrives. Quick response is crucial in serious conditions. Debunking common first aid myths. There are many myths about first aid that can be harmful. It's important to know the facts. One common myth is using butter on burns. This can cause infections and should be avoided. Another myth is tilting the head back during a nosebleed. This can cause blood to flow into the throat. Instead, lean forward and pinch the nose. This helps stop the bleeding effectively. Some believe that you should induce vomiting if someone swallows poison. This is dangerous. Instead, call poison control for advice. Knowing the facts can prevent harm and ensure proper care. The role of first aid training in schools. First aid training in schools is crucial. It prepares students for emergencies. This knowledge can be life-saving both in and out of school. Children learn best through hands-on experiences. Practical first aid training makes the lessons memorable. It also builds their confidence in handling emergencies. Schools can incorporate first aid into their curriculum. Regular drills and workshops can reinforce these skills. This ensures that students are always prepared. First aid training also promotes a culture of safety. Students learn to look out for one another. This sense of responsibility extends beyond school walls. It fosters a safer and more caring community. First aid skills for the workplace. Workplace safety is a priority. First aid skills are essential for employees. They can prevent minor injuries from becoming major issues. Training employees in first aid builds a safer work environment. It reduces the risk of accidents. Employees feel more secure knowing they can handle emergencies. Regular first aid training sessions should be conducted. This keeps skills fresh and up to date. Workplaces can also install first aid kits and ensure they are accessible. A culture of preparedness benefits everyone. It shows that the company values employee safety. This can lead to higher morale and productivity. First aid skills are an investment in workplace well-being. First aid at home, safety for families. Home is where most accidents happen. First aid skills are crucial for family safety. Parents should know how to treat injuries and respond to emergencies. Children are prone to accidents. Knowing first aid helps parents act quickly. It can prevent minor injuries from becoming serious. First aid kits should be stocked and accessible. Regularly check and replenish supplies. Teach all family members how to use the kit and respond to emergencies. First aid knowledge empowers families. It builds confidence in handling emergencies. This creates a safer and more secure home environment. Preparedness is key to family safety. Conclusion: empowerment through first aid knowledge. First aid knowledge is empowering. It equips individuals with the skills to handle emergencies. This can save lives and prevent injuries. Understanding first aid builds confidence. It allows people to act quickly and correctly. This reduces the risk of panic and mistakes. First aid training should be accessible to everyone. Schools, workplaces, and communities can all benefit. A well-prepared society is a safer society. Empower yourself and others with first aid knowledge. It is an invaluable skill that can make a difference. Be prepared, stay calm, and act effectively.